5:24 a.m. Heads up, parents, be on the lookout for RSV. It's a respiratory virus that can be dangerous to some young children and babies. Healthcare providers in the Permian Basin say they've seen an uptick in cases. News West 9's Lilybeth Valles has more.
It's the uninvited guest that shows up every year.
RSV is a respiratory virus that commonly infects people during the fall and winter season.
And this year's respiratory illness season is no exception.
For this area here, we have seen an increase in RSV for the season. We had quite a bit of a spike in December. In January, and then it's somewhat mellowed out or kind of plateaued a little bit now. But it definitely has been prominent in the younger aged children.
There's been an uptick in RSV cases in babies and infants, says Brianna Romero, the infection control manager with the Odessa Regional Medical Center. But she says she's not concerned by the numbers.
We haven't had too many that have been hospitalized, but with that being said, it's still very risky for that population.
What may be an inconvenient cold to you and I can be life-threatening to babies.
Candace Herr, a care coordinator in the pediatric services with the Medical Center Hospital, says there are signs for parents to watch out for.
This one with eating, not wanting to eat, definitely when in their ribs, you're going to see them pulling at their ribs. They're going to have retractions. They're going to be very fussy. They're not going to be sleeping very well. They're not going to have as many wet diapers because they're not intaking. And those are all very serious and they need to be addressed.
In terms of fighting back and stopping the spread of RSV,
staying at home can be helpful for those who are able to. If you have a baby or a child who attends daycare or school, you want to keep them out, right? So that you prevent the infection from spreading. Also, hand hygiene, right? Washing our hands very frequently is important.
RSV antibody immunization is recommended for all infants younger than 8 months, born during or entering their first RSV season. Now, most infants whose mothers received an RSV vaccine do not need to get an RSV antibody as well.